Hi, this is Dr Aleem at the Kensington Clinic. So today what we're going to do is just go through some of the questions that people are asking about veneers. So essentially I'm doing a lot of virtual consultations for patients asking about veneers, the treatments, the indications. So what I thought I'd do, which would be helpful, is to kind of give people an idea of what we do here, what are the options, and how we go about veneers and treatments that are similar. So the first question is that people ask are about veneers and who they're suitable for. So by the mere fact that people are asking for a veneer consultation, they've obviously done some research, they've seen what people have had, and essentially they want to improve on the appearance of their teeth. So that's essentially why we do them. There's various reasons for that, but that's essentially the main focus. So to improve the appearance of the teeth and their smile. So now, this is a very, very common question. Do dental veneers damage your teeth? Now, this question is probably the most, I get this asked more than anything else. So it depends who does it. That's the answer, which is not the best answer, but it really does. So some dentists practice veneer preparations that are minimal, some that are very aggressive, and some that are totally non-preparation. So how do you decide? Well, it depends on each individual case. So there is no set answer. Each individual case needs to be treated differently. Now, all I can tell you is what I practice, and what I practice is pretty much non-preparation. So the veneers that I do, I would say 90 to 95% of them are totally non-preparation, which means we don't cut the teeth at all. So why do we do that? Because I don't believe in cutting teeth. Where possible, we should not, because it's the only thing you're doing is doing harm to the tooth, to the patient. So we do very, very little preparation or no preparation. So when do we do preparations? Okay, so when we have to replace someone's veneers, then of course we would take off the veneers and they'd already be prepared. In those cases, sometimes you have to modify the preparation to make it acceptable for new veneers, or the other reason why you'd have to modify it is if there was any sort of dental issue, decay or recession of the gums where the gum goes down. So you have to then make sure the veneer covers that area. So you have to modify it. So, and the reason we try to avoid doing any aggressive preparations on teeth is because morbidity of tooth structure. So if you start to aggressively cut teeth, you'll find that you will get problems down the line with root canal treatments and such things. So that's in essence the reason why we practice non-preparation veneers or very minimal preparation veneers. So the next question is, what if my teeth are not aligned properly? Well, this is a situation where the best solution to this is always to do some aligning treatment before having veneers done. So what that would mean is having a small course of Invisalign or some type of orthodontic appliance to get the teeth in the right position such that you can do veneers and do either no preparation or minimal preparation. So that's the way I like to practice. And I can't really comment on what others do, but what I would say is there are not that many people who practice non-preparation veneers, and I think there's various reasons for that, but ultimately it comes down to also how comfortable your technician feels about making non-preparation veneers. So we have a technician based in California who does all my veneer work, and he's an accredited member of the AACD, which is one of the highest bodies of qualification and certification. So he's very comfortable doing that, and I feel comfortable doing the non-prep veneers with him. I don't do them with anyone else. We've been doing non-prep veneers for very many years, and we've had great success. So I feel comfortable with doing it because of the team that I have, and also the knowledge of the bite, which is the key factor in longevity of veneers. You have to make sure that the veneers fit the mouth and that the person's able to chew and masticate properly. So that's a very long answer to the question of do veneers damage teeth. So essentially the ones that we do, no, but I am aware of, unfortunately, a lot of cases where people have very, very aggressive treatment on their teeth. Teeth are cut massively, there's hardly any tooth left, or they come in with little pegs, as they would call it. And those situations, they're not conducive to longevity of the treatment, and also you get a lot of post complications, which I would not advocate. So we do not do aggressive veneer preparations. We would, even if someone requested it, I wouldn't do it, because I always believe in getting the teeth in the right position, and then and only then do we do the veneers afterwards. So, do dental veneers stain is another question. So porcelain veneers, which is the most common type of veneers that we provide here at the Kensington Clinic, which are made in California, they don't stain because they're ceramic. And because they're ceramic, they don't stain. Composite veneers, which are directly done, which we also do, they do stain because the resin loses its shine after a while. So you have to repolish it every now and again. They still look good, but they don't have the same sort of longevity as ceramic veneers or porcelain veneers. Do dental veneers hurt? Well, that depends on the dentist and the preparation design. So if they're non-preparation, there's no pain whatsoever. If there's a very minimal preparation, then you don't even need to give an anesthetic, so they don't hurt. If you have to do an aggressive preparation or remove existing veneers, then of course you'd have to give injections. So during the process you don't feel anything, but you will have to have some local anesthetic around the teeth and gums. The way we remove veneers here is quite unique. We have a laser which disintegrates the actual veneers. So one of the worst things for any aesthetic dentist who's doing a lot of veneer work is actually removing veneers. So before I had a laser, it was probably the worst procedure. I hated it simply because you would sit there for hours taking off a veneer because it looks so much like a tooth. You don't know once you've cut through the veneer and when you're at the tooth. And if you're very, very particular about cutting teeth like I am, I would spend hours taking them off, and it was very, very difficult. So now, for the last few years, we've had a special dental laser, which I got pretty much for this procedure, where it actually disintegrates the cement within the veneer. So as you put it onto the tooth, it just disintegrates. The veneer just starts shattering off within seconds. And that is probably the best thing I've ever invested in. Makes life a lot easier, but most importantly, the patient doesn't not lose any more tooth structure. Literally, as soon as the ceramic comes off, all you're left is with the dental cement, which comes off very easily, and then you're away and ready to go. So with that, we have this on our YouTube page, videos of us removing veneers, and that would be the best way to take off ceramic veneers. So another question, do dental veneers look natural? That depends on what the patient wants. Our veneers, made in California by my ceramist Craig, they look supernatural because that's the type of veneers he likes to do and I like to do. So the art is an illusion. We want to actually mimic what the tooth look like so that no one can tell you have veneers. So most of my patients, when they've had veneer treatments, I always ask them afterwards, did anyone notice? And most of the time, no one does. All they'll say is, okay, there's something different about you, but they can't put their finger on it. And that's actually a big compliment for us, because we don't ideally want you to be showing your teeth so someone can see it from a long way off. We want it to be very natural, but look very beautiful and white. So we want them to just say to you, you've got beautiful teeth, rather than, you've had your teeth done. So the way that is they look natural because they're very thin, so they don't look like they're coming out of your mouth. Like unfortunately, you see some cases where the teeth just look huge. So they look very natural in that sense, but also they mimic the anatomy of the tooth. So the texture, the translucency is all what a natural tooth would have, so that you're not able to distinguish it. Of course, what I'd recommend is just look at some of the cases online in our gallery to be able to see what I mean by this. So some patients want them to look supernatural, some people want them to look very white, which we also can cater towards, and some people just want it to look like what they had, but just with some improvements, which we can also do. So it really depends on the person, but we prefer to do cases that are invisible. So bright, but very natural. Another question that we get often asked, do dental veneers last forever? Nothing lasts forever, unfortunately. However, dental veneers now, they last probably a lot longer than they used to, simply because of the different quality of cements and bonding agents that we have. So our dental veneers are mainly feldspathic veneers. So what that means is there's different type of ceramics that are used. Ceramics, porcelains are effectively the same thing, and we use feldspathic, and that's because the technician likes to use it, and it's basically powder. So he hand makes it using powder ceramic. There are different options now. In a case where someone's got a very heavy bite, what we would do is we'd use a different type of ceramic called Emax, and then layer on top of that with feldspathic. So how long did it last? It depends case to case, but I would expect veneers to last a long time now, 15 years plus. I've been doing this a long time, and fortunately I've had to replace very few cases. The odd veneer you may have to replace because of trauma or something happens to it, but in general they don't fail. If you're doing a very minimal preparation and you're bonding them correctly, and most importantly you're allowing the person to function without any sort of issues, then there's no reasons why they can't last for 15, 20, 25 years. So they last for a long time. Another question: if I've had old ceramic veneers work done abroad, I want to remove it, are you able to do this, and are you going to cut my tooth? So patients who come in who've had existing veneers done and want to remove them, like I said, those cases are quite challenging because we don't know what's underneath those veneers, but with the laser we are able to take them off without damaging any more tooth structure, and of course we're able to replace them as necessary. So we are able to do that, and we do not cut the teeth anymore. Another question is it possible that you cannot place veneers? Yes, sometimes if a tooth is heavily broken down or has had a pre-existing veneer or crown on it, you would have to replace it with possibly a crown, if it has a crown existing on it. Or if the tooth is very broken down, then we have to consider doing like a 3/4 veneer or something like that. But in essence, we always try to place a veneer where possible rather than a crown, because the less destruction you can do of the person's own tooth, the better. Another question: dental veneers versus composite bonding, which one is better? This is really case dependent. So composite bonding we offer to patients who want a direct improvement. We do it chairside, it's done straight away. We can of course improve the shape, the color, as well as add texture to teeth. It works really well for a lot of cases. I mean, we have a lot of cases where we do composite bonding, and you can see that on our gallery. Ceramic veneers is definitely more of a premium option because the ceramist spends hours making them, so we can't spend that much time in the chair doing a composite veneer, and the ceramist can also make ceramic veneers very, very, very thin, which you can't do with composite. So ceramic veneers is a more premium option, but we offer both. So neither one or the other is better. It really depends on the case. But most patients who want a Hollywood smile or you know, a massive smile transformation would have ceramic veneers. Another question: if my teeth are not aligned, can I get veneers? So yes, of course, you can have veneers in many situations. If your teeth are not aligned, then in those circumstances, we would always prefer to align your teeth and then do your ceramic veneers or composite veneers, simply because it's better to have the teeth in the right position than have to cut the teeth into the right position, which we don't really advocate. We don't like to do that. Orthodontic treatments can be invisible aligners, Invisalign, and they can be moved into the right position in a matter of weeks, 6-7 weeks, and then you can have your ceramics over the top. We do a lot of this. Most of our cases for full mouth veneers, we would do some minimal orthodontic treatment just to get the teeth in the right position, and then we can do non-preparation veneers. So there is literally no cutting. What shall I look for when deciding on veneers? So this is a very good question. I would say that the most important thing to look for in someone you choose to carry out your treatment is the person you have the best relationship with. You'll be spending a lot of time with your dentist doing this procedure. So I think it's actually very important for you to understand each other and also really understand what's being done, and the dentist needs to understand what you want, and that's really important. I would say that looking at cases before and afters will give you a good idea of the type of work the person does in general, and you can see if that suits what you're looking for. But overwhelmingly, I would say that having a really good relationship with the dentist is the most important factor. And it works the same for dentists. Like, we like to work with patients who we have a good relationship with, because otherwise the whole process becomes much more difficult than it should be. What is smile design? Smile design, also known as DSD, which is digital smile design, is the way that we are able to actually design your smile digitally. So the process of this is very straightforward. We take a series of pictures, which we do for every single case, and also videos of you speaking in general. And we're able to use those photos and videos to digitally show you how the smile can be changed with veneers. So it's a very powerful process. We do this in all of our cases anyway. So it's something that we do regularly, and it's just part of our protocol. And also videos, because with videos you're able to see how much someone's showing their teeth when they smile, when they speak. And again, we design the smile not just with photos but with videos, because you need to be able to see how when someone laughs, how much they laugh, and how much tooth is shown, how many teeth are shown. So digital smile design is very powerful, and we use it in all of our cases now as a tool to show you how your teeth will look. I hope I've answered your questions. Like I said, these are the most common questions asked during our virtual consultation appointments. If there's anything else, please don't hesitate to contact us.